And one part of deciding whether or not somebody has neuropathic pain is a sensory loss. So in a sensory loss, therefore, in a standard neurological examination, and I might be a bit biased because in my clinic, I see mainly patients with nerve problems. But I would always include, as we said, large fibers, light touch, reflexes, muscle strength, but also small fibers, pinprick examination. And if pinprick is normal, then I would move to thermal. And that is because of work that we have done together with Colette, where we have shown how the sensitivity specificity works of these tests. That this would be the recommended route. But at least pinprick I would recommend to do in a screening examination in a way. And these if I do a screening examination in patients, I would say this takes me 3 minutes maximum. But it has potentially quite important implications for if I identify, for example, something is more related to neuropathic pain, that might be important on how I help people make sense of what is happening with them, right? How I explain a neuropathic pain will be completely different to how I explain, say, a muscle pain, for instance. We already touched on pharmacology, which might be influenced by these kind of things. So I believe it's quite important that people have a relatively comprehensive neurological examination. Let me give you one other reason for that. Is when we test the shoulder, we would also not be happy to just say, okay, somebody has flexion deficit, right? We would probably test many different things around the shoulder. Then we put the puzzle pieces together and we see whether the puzzle pieces fit or not. So if I only have a neurological examination with muscle strength, I have like one puzzle piece, which might well not be enough for me to make sense of it. But if I have many different puzzle pieces and they fit together, that will tell me something. But it will also importantly tell me something if the puzzle pieces don't fit together.